means this is actually a conference where you have some of the best minds in the world working on HIV control and now treatment as prevention being a focus.
From WHO's perspective, we've been sending somebody to this meeting, I would say, at least for 3 or 4 years. The reason being is we think it's a really good venue to meet academics who are working on the latest science related to earlier treatment and finding the results that could be beneficial for us as we look at the next generation of guidelines. And number two, I think it's important. I think we're all in this game together as we want to do the best for the most patients who are ill in the world and with HIV. And so for that reason, I think it's good to show the solidarity between the UN agencies and academia, and also to hear from what's happening in the field.
There are a number of ways in which the myriad people who are here for this workshop can implement some change. One, obviously, is by going out into our respective communities and preaching the good news of treatment prevention. We have not been as loud in our communication about this good news as those who are opposed to it for a variety of reasons. And so reaching out to our community, reaching out to communities that are increasingly being charged with providing care to people living with HIV/AIDS, and here I'm talking about the primary care community, is one important way of doing so. The other is increasing community engagement, and that engagement needs to be much more than on the advocacy front, which is important, and on the accountability front, which is equally important, holding providers, holding governments, holding policymakers accountable. It involves engaging them actively in the care and treatment of people living with HIV/AIDS, a very resourced and educated community, particularly as we're trying to convey what can sometimes be very complex messages.
There's no way we can have one experience that fits all, but certainly we can convince policymakers based on evidence and based on cost effectiveness and based on of course, besides saving the life of people, besides preventing or controlling an epidemic, there is a very big impact in the health system if you don't do anything. Because more people will need hospitalization, more people will need very expensive medicines, and if you start treatment very early, you avoid everything like this. And this is probably the main argument worldwide to convince politicians, to convince policymakers, to convince ministers to change and to follow what science is showing clearly.